Hello and welcome to our webinar on preventative health with Richard Saunders, that's me, for Rabbit Awareness Week. So we're going to talk about diet first, and it's really difficult to feed rabbits, making sure that you don't feed too much concentrate food and not enough forage. We've got to get that balance right, and we've got to consider the concentrate food as essentially a hay balancer, something that just makes sure that the rabbit gets enough of certain nutrients in its diet. We also need to be careful that we don't allow selective feeding. Now, this is a particular problem where we've got multiple rabbits feeding from the same source of food, but it can occur if we feed a mixed food that the rabbit can pick its favourite bits out of and leave the rest. And it's quite challenging to provide enough access to hay, access to growing grass particularly, because that entails keeping rabbits outside, giving them large run areas, or providing lots and lots of fresh, tasty, nourishing, palatable hay. But this is worthwhile. It is vital to the long-term health of the rabbit, particularly with regard to dental problems and gastrointestinal health problems. So we need to firstly make sure that we give relatively little concentrate food and relatively lots and lots and lots of forage, which is grasses, dried grasses, hays, dried weeds, etc. What we found, or what the PDSA found in the 2018 report, was that despite being an animal which is known to eat grass, we still see a lot of rabbits fed. We see a lot of rabbits, up to 200,000 rabbits, still fed a muesli-based diet. And even the ones that are on more pellet and hay-based diets often don't get enough hay compared to what they should get in the wild. And if we're not careful, if we feed too much concentrate food, this really energy-dense, high-fat, high-starch, high-carbohydrate, high-sugar diet, we can end up with these little hutch potatoes, these rabbits who become hutch-bound due to lack of exercise provided by owners, and they're fed an inappropriate diet, a high-energy diet. They're not allowed the exercise that would help them to burn off this high-calorie diet, and that becomes a bit of a vicious cycle, because the less they move around, the more they're inclined to become obese, and the more their joints start to suffer, and the more likely they are to get problems such as fly strike, such as cecotroph accumulation around the back end, pododermatitis, urine scalding, etc. So, particularly problematic trying to avoid selective feeding when we have multiple rabbits, because you're going to find that the dominant rabbit, the rabbit who pushes its way into the food bowl and eats its fill of its favourite food items, is going to get relatively more of the starchier, sugarier, tastier food items that rabbits would select for in the spring in the wild, when the new growth that's coming through is relatively high in sugar. Rabbits have got a little bit of a sweet tooth. So we're going to predispose amongst those rabbits particularly to developing problems like obesity and dental disease and so on. The other rabbits may, ironically, despite being lower down the pecking order, may actually get a healthier diet and be healthier for it. And so really what we want to do is mimic the situation here with wild rabbits who've got fresh access to growing, tasty, palatable grass with a high water content, which is good for urogenital tract health, good for urinary tract health, a mix of ideally different grass species, just to create some variety and to allow some selectivity within their feeding, so they can forage and pick out the bits that they like preferentially without doing themselves any health issues, and ideally lots of room to run around in, which is easier said than done in captivity, and also free access to that grass 24/7, because it's very easy for owners to fall into the habit of popping the rabbits outside, perhaps when they get up, when the sun's relatively high in the sky and the dew on the grass has evaporated, and normally those rabbits in the wild would be out there very much around dawn and dusk, when they're a little bit safer from predators, when they're not exposed to the sort of unrelenting heat of the day, and they'd be able to eat a relatively high water content grass with natural dew on it, which provides a lot of fluid to help their urinary tract health. So ideally we give them free access, we have them able to go in and out as they will between a secure shed or hutch type arrangement, a spacious arrangement, and a nice, spacious but safe and secure run that's proof against foxes and cats and so on. If we give too much of any concentrate food, we're going to run into problems, and probably the two main problems that we're going to talk about here are dental disease and gastrointestinal problems. So, for example, we see in this rabbit a case of a rabbit who's developed incisor tooth problems as a result probably of an imbalance of nutrients in the pelleted diet, plus secondary problems developing cheek tooth problems as a result of inadequate attrition, inadequate wear, and not just lack of wear, but a lack of the correct pattern of wear that we see when rabbits are preferentially fed more pellet than they should do. So we decided to turn this upside down because the traditional food pyramid with pellets at the top here kind of focuses the mind, focuses the eyes on the fact that the pellets are there at all. And what we kind of really want to get across here is that grass and hay should be the vast majority of these rabbits' diets. This is getting through, this information is getting through from vets to owners with the help of feed companies, with the help of charities, with the help of Rabbit Awareness Week generally. So we're trying to get that across, and we are succeeding, but we still need to make more effort, we still need to keep that up. And to talk about not just giving hay full stop, but giving the quantities of hay and making sure that hay is palatable and something that rabbits actually want to eat. They don't just push it out of the way to get to the grass, the green leafy vegetation and the pellets and so on. So the important thing is we can dilute a small number of pellets by feeding lots and lots of grass and hay, and dilute their effect or their negative effects on the rabbit. As I said, it's especially problematic if we're not just feeding a homogeneous pellet, a pellet that where every little bit of the pellet looks like every other bit, every bit's got the same ingredients, every bit's got the same nutrient content. If we have bits that look different, bits that have different composition, we allow the selection of something like the flaked maize and the flaked peas and such like. These things tend to get eaten, these little cornflakey type ingredients tend to get eaten along with some of the whole grains, and these have high sugar content. They also have really poor calcium phosphorus ratios, and so it's possible that we could end up with a nutritional imbalance which further contributes to dental problems. And if you've got this one rabbit pushing its way in, it may all eat it may eat all the bits that it likes and leave the rest, these boring pelleted bits, which are nevertheless probably the healthiest component in the whole thing. So both enough grass and hay indoors and outdoors. If the rabbit's an indoor rabbit, it is a bit messy to feed grass and hay, but that's something that people have to accept when they take rabbits on as pets, when they decide that a rabbit is for them, and they need to feed that grass and hay in such a way that it doesn't get scattered around the house too much, in a form that the rabbit can eat it. So this is quite nice. This is not so much a hay basket or a hay rack, but a sort of hay creep against the wall, so the rabbit's able to eat. We're able to keep it off the floor so it doesn't get trodden on, doesn't get dirty. But it's better than a hay rack, because hay racks tend to be a little bit high for rabbits' heads and encourages them into a slightly abnormal position, stretching their heads out and eating food from a height. Rabbits do eat from hedgerows and so on, but it isn't the main way in which they eat, so it's nice if we can provide that food at ground level. It mimics the natural head position. So indoors we can provide them with hay, dried grasses, fresh grass that's been plucked from the outdoors, but not clippings, not fermentable grass products and so on. And outside, obviously, we ideally want to give them access to fresh, still growing grass, because that's even better. So these rabbits have got access, they've got shade, which is important. It doesn't matter if we have access potentially to grass, but they're exposed to sunlight, they're in harsh, unrelenting sunlight, and perhaps they're keeping out of that sun because that's not a particularly natural thing for a rabbit to do. So they self-select for confining themselves to the shade, and they miss out on all the grass. So providing shade, providing a safe environment for them to freely eat that grass is really important. And although rabbits are typically crepuscular, active at dawn and dusk, if people are around and if they're quite bonded to their human owners, they will tend to be a little bit more flexible with their diurnal rhythms, and so may actually come out a little bit more during the day than the normal wild rabbit would. So the health issues that we tend to see with poor diets, we talked about, how to provide those diets and what to provide. But the main health issues, if we get it wrong, are dental disease problems and interruption in GI, normal GI efficient motility. So these are both potentially fatal conditions. This is a sick rabbit on intravenous fluid therapy prior to dentistry or in conjunction perhaps with GI stasis, GI slowing down and so on. And this can be a potentially fatal condition if it's not caught early enough. Prevention is very much better than cure, and a good diet will go a long way towards preventing both of those problems. Obviously we get the odd broken tooth, we get the odd foreign body obstruction of the gut, which no amount of good feeding is going to prevent, but we're talking about the acquired dental disease, the acquired GI stasis, which we can largely prevent. So it's a little bit controversial exactly how diet or poor diets cause dental disease in rabbits, and obviously there are other causes for poor dentition, but we're mainly going to be talking about this acquired dental disease problem, and it tends to start in the cheek teeth, although we'll often see ribbing and ridging of the incisor teeth and a loss of the nice shiny creamy to white enamel. We'll see those kind of changes at the enamel level, but problems tend to begin with the cheek teeth, although that's not necessarily what the owners see first. And we think primarily that this is the fact that the cheek teeth aren't being expected to work as interdigitating, serrated, grinding and chopping surfaces. They should be working nicely in a kind of figure of eight movement with the upper and lower teeth occluding to shred grassy material between those occluding cheek teeth surfaces, and that should turn the ingested food into a nice particle size for ingestion, for going down into the stomach to passing through the small intestine, and then being a source of fermentation for bacteria and protozoa to get to work eating the indigestible components. The components that are indigestible to mammals. So if we start to see overgrowth, effective overgrowth of those cheek teeth and distortion of the shape of those cheek teeth, curving within the jawbone and so on, they will develop in a fairly predictable pattern, malocclusion, which will then stab into the tongue. The lower teeth tend to stab into the tongue, and the upper teeth tend to direct themselves towards the inside of the cheek. And the lengthening of those teeth relative to each other and the fact that they can't now grind properly tends to bring those out of occlusion and tends to then bring the incisor teeth out of occlusion, so they don't meet and they overgrow. Another possible factor is the relatively poor calcium content of especially a selected mix-based diet. So if they're picking out the ingredients which have got relatively low levels of calcium and a relatively poor calcium-phosphorus ratio, then we've got the potential for inadequate bone mineralisation, which is certainly not going to help in a rabbit which has continuously growing teeth which are being subjected to unusual forces upon them by a different wear pattern, a different eating pattern, because they're eating pellet, not grass and hay. And also the subject of vitamin D is a hugely controversial and hugely evolving topic, with vitamin D being provided to rabbits either through metabolism in the rabbit's skin under the influence of ultraviolet light, which is obviously not going to be an issue in indoor rabbits. They're not going to obtain that UV through glass, which filters it out. And rabbits which are outside may be in shaded areas, they may be in hutches, they may not be exposed to natural sunlight. It's questionable how much natural sunlight rabbits will get in the wild, but they do predominantly come from more southern European climates where the UV levels are much, much higher. So it may be a combination of not getting quite enough in our northern hemisphere, northern latitudes, especially if they're indoors, especially if they're predominantly in a hutch, and potentially not getting enough in the diet because of selection within the dietary ingredients. Hay is actually in some ways a better source of nutrition for rabbits with regard to vitamin D, because if it's been dried by the sun, we've also had UV affecting its vitamin D levels and increasing those. So fresh hay that's been sun-dried is actually a relatively good source of vitamin D, and that goes down if that hay has been stored, especially if it's been stored badly over some time. There's an argument for possibly providing extra vitamin D to rabbits at particular risk of problems, but the consequences of overdosing with vitamin D can be equally serious. They can affect bone metabolism, they can affect calcium deposition within the tissues, potentially cause renal issues. So it's kind of the jury's out in terms of providing any extra supplementation, and at this point we would suggest dietary vitamin D and UV light is sufficient without adding in extra supplements, which perhaps of the sort that we might be providing for reptiles and birds. This rabbit obviously is these incisor teeth never going to meet. This is a rabbit that's been born with a congenital malocclusion, which makes itself clear as soon as the teeth erupt, and this rabbit's never going to, however good its diet, is never going to restore itself to normal normal dental anatomy. This, on the other hand, this rabbit has got secondary incisor problems as a result of overlong and distorted and maloccluding cheek teeth. So this is something that we could prevent rather than ideally prevent rather than cure. And those problems at the back, they have a tendency to be hidden. We have a problem here where this tooth is leaning in, slicing into the underside of the tongue, and the chances are that the owner doesn't notice this. The owner notices the rabbit dropping food out of its mouth, perhaps, losing weight, possibly going into GI stasis because of pain, etc., but probably doesn't notice any cheek teeth problems before perhaps secondary incisor problems are noticed. There's a tie-in between poor dentition, dental pain, and GI motility. Obviously a rabbit in dental pain is going to stop eating either suddenly or gradually over a period of time. The overlong incisor teeth that we see may functionally prevent that rabbit from actually eating. It may not be able to prehend food with overlong incisor teeth. And if we feed a diet which is high in simple carbohydrates, high in water-soluble carbohydrates, starches and sugars, we're going to see a dramatic effect on the population, the gut bacterial population in the hindgut, and that may ferment away, producing unusual bacteria or encouraging unusual bacteria such as some of the Clostridial organisms, and changing the pH of the output of the hindgut, which can have a very marked negative effect on mobility of the gut. Couple that with a low fibre diet which lacks that kind of scratch factor that activates GI motility, and we have a potential gut that may stop moving at any point. Simply eating a lot of fur because they're grooming one of their companions could be enough to slow that gut to a stop. Any sort of pain or stress on top of this, again, could slow that gut to a stop. So these rabbits are at high risk of GI problems. And the longer this goes on, the slower the gut moves, or the longer the gut is shut down for completely, the worse things get, because as GI content starts to move through more slowly, it has more time to dry out as water is sucked out from the ingesta across the gut wall, and it also has more time for the sugars within that and the other components within that to ferment away, producing gas, which stretches gut and causes a colicky pain, quite a severe pain. Thank you very much, and we will do part 2 shortly.